My name is Rachel, and I'm a pharmacist in the community setting in Wichita, Kansas. My career interests are in health outcomes and epidemiology. Ultimately, I'd like to hold a faculty position at a school of pharmacy or school of medicine. I'm interested in research and teaching. Essentially, I'm interested in finding out whether or not all of this medication that we take as a country is really improving our lives. It's interesting that this first chapter mentions how cause of death has changed over the centuries. It used to be that infectious disease was rampant, and you were lucky to make it past the age of 25. Now that these infections are largely kept under control, we are killing ourselves as a result of our poor lifestyle choices rather than poor luck. As a pharmacist, I'm a member of the medical care team. We're primarily interested in treating diseases rather than preventing them. You make a doctor's appointment to address whatever physical ailment you have. The doctor writes you a prescription to treat it, and the pharmacy gives you the medicine. Slowly but surely, we're seeing a slight change in tide in how we as a medical community view public health. Lots of doctors' offices hardly carry any vaccines anymore. It's typical to visit your local pharmacy to get your vaccines. Here in the last 10 years, it just became legal for pharmacists to administer vaccines in Kansas. Other states are more progressive with what their pharmacists can do, but Kansas is still pretty limited. In the last few years, I've seen insurance companies decide to totally cover vaccines at the pharmacy. Insurance companies are also implementing medication therapy management programs, or MTM programs, to minimize the insurer's lifetime cost. For example, Medicare programs reimburse pharmacists to conduct an annual review of your medications to check for indication, side effects, and cost issues. Pharmacists are the drug experts, and the third-party payers are saving money on hospital visits by ensuring adequate drug therapy for their patients. This new ground for pharmacy has been very exciting. Unfortunately, some pharmacists and physicians are resistant to these changes. Doctors don't like being questioned about their medication choices, and some older pharmacists just don't see the purpose in performing these MTM services. Pharmacies traditionally make money by selling prescriptions. Now we're starting to make some revenue from insurance companies through MTM. Pharmacists are the most accessible health professional. You can walk into a pharmacy and get medical advice within minutes. This setup is unlike any other in the medical setting. I see a lot of patients who don't have insurance and avoid going to the doctor at all costs. They want recommendations on over-the-counter products they can use instead. I field a lot of questions from people who say they're tired of taking medicine and they want to know how to get off. I take a look at what's in their grocery cart, and it's pretty clear why they're on medication. I explain that diet and exercise to reduce 10% of body weight can remove the need for one blood pressure medication. But most folks say they would just rather keep taking the pills.